Getting diagnosed with breast cancer is not something easy to digest. Even until now, it seems like it's a distant dream. It seems like it's like, is it even real?
You know, when you first hear it, it's like, oh my God, why me? And if you have your anxiety and your concerns, it's only natural. But we just put one foot in front of the other. Just know that the next day is coming and to look forward to something on that day.
In May 2018, I was diagnosed with triple positive breast cancer. Actually, I was in denial at first, thinking that it was going to go away. But then my dear husband was the one that made the call and made the appointment. It was a triple positive tumor. Then my treatment was chemotherapy first. After that, it was followed by lumpectomy and then radiation. It was hard for me to do daily things, but luckily I had a lot of good supports from family, friends, and community to help me get through it.
Oh, good to see you.
Good to see you. Dr. Eftimia has been very supportive. He's always there along the way. Any symptoms or side effects I had.
Vanya, she was diagnosed with a fairly advanced stage of breast cancer. She actually went to a few different places around here for treatment of her cancer, but she chose to actually do her care over here at the UCSF Washington Cancer Center. She has done phenomenally well. The chemotherapy treatment that she underwent is not an easy treatment.
The hardest part would be thinking if I'm gonna be there for my kids the next 10 years or not. I had to let them know in the very beginning, and they accept that fact. And of course, they had a lot of questions. They were a bit scared. So it was quite an interesting journey.
The goal of the UCSF Washington Cancer Center was actually to make this transition between a very well-regarded community hospital and take this, combine it with a very well-regarded university center, and offer the patients the best of both worlds. The end goal is to make the patient comfortable where they are at.
1 in 8 women will develop breast cancer in their lifetime. It's still one of the leading causes of cancer in women, and it's still one of the leading causes of cancer deaths worldwide.
When they told me I had cancer, I just thought about all of the negative of cancer. It's been almost 18 months, and I was going in for my annual physical. You do your mammogram as you do at my age, and so they called me and said, you need to come back. And I thought, come back? So I went back and had a repeat, and then they said, okay, we need to have you talk to the nurse navigator. So that started my journey. My surgeon said to me, although it's bad news, the good news is that because you have regular maintenance, we found it early. So I'm in the recovery phase. I completed my last radiation treatment in January. So for the last few months, it's like getting back to my new normal.
Ruth is an amazing individual. She has an extremely strong will. She's a survivor. She has had to go through some rigorous treatments for her breast cancer, but her positive outlook is amazing. She'll also need an appointment with radiation oncology.
Dr. Degoni, I just love him. He is the greatest. And then my oncologist is Dr. Eftimia, and they both are a wonderful team together. Washington Hospital, just to have them 5 minutes from my house was wonderful, and to be able to go to an infusion center without having to cross any bridges to go to San Francisco, Palo Alto was excellent. For my family, it made it a lot easier for them because they're all here in the Tri-City area. So I can't say enough about that office. I really love them.
We were the first nationally accredited center of excellence for the treatment of breast disease, and in particular breast cancer, in Northern California. When someone's diagnosed, a panel of experts all get together twice a month and look at and discuss newly diagnosed breast cancers and make sure we're all in agreement on how it should be managed. And we have 2 excellent nurse navigators which help get them through the system.
I'm feeling good. There were some difficult days during treatment, but just to be able to get up and to breathe and to be out in the air, you have to stay positive and keep looking for the best.
I'm very happy with the outcome because every step of the way we chose really carefully. I feel confident in all the treatments.
Ultimately, the goal is, can we actually give patients a hope for tomorrow? And in doing that, can we actually give them the best care that we can? And at the end of the day, realize that we've left no stone unturned, and we were able to help this patient and their family as best as we could.
Learn more about breast cancer at BayAreaHealthierTogether.com.